Hey everybody, this is Dr. Nick with the Springfield Wellness Center. I'm here with my lovely assistant Brooke today, and we're going to be talking about migraine headaches and what you can do to fix those. So migraine headaches are kind of a tricky beast. It's sometimes hard to determine what is causing the migraines, and so that's why you really need to be checked out by a professional so that we can decide what exactly is the trigger. Things that can trigger a migraine can be hormone shift, food allergies, just your daily life, like what you're exposed to in your environment, and then also it can be coming from your neck, and that's what we're going to be dealing with today. So here in the office, there are three things that we really focus on when treating migraine headaches. The first of which is going to be the most important, and that's going to be the alignment of your two upper cervical vertebrae. So with your spine, your cervical vertebrae are the top 7 bones, and these top 2 really affect the nerves that go up into the head and can create migraine headaches. Now, migraine headaches are different than, say, tension headaches or cluster headaches in that they have symptoms that those other headaches don't normally have. It can be nausea, sensitivity to light, fatigue, dizziness, blurred vision, and so they're a more severe version of your regular everyday headache. So some people have them daily, some people have them once a year. But if you are having them, I always say about headaches that they're common, but they're not normal. So if you're having headaches, it means that something's going on that needs to be addressed. And a lot of the times it is going to be these top 2 vertebrae being out of alignment. So if your top vertebra is out of alignment, it can press on that C1 nerve. That C1 nerve runs up into the head. C2 is also a problem, but the big focus that we have with migraines is going to be on C1. Now, if you don't have a problem with C1 or C2, we'll be able to tell that in the exam. If you don't, then it's probably coming from something else. But like I said, you have to get that checked out by a professional to be able to decide if that's what's going on. So I'm going to kind of show you how the adjustment would work. So I'm going to have Brooke lay back here. Brooke just went to a water park on Saturday, so she's had some wild rides, so we'll see if there's anything in there that needs to be addressed. So she doesn't have, well, there's a little bit right there. Normally when I'm feeling the top 2 vertebrae, I'm looking to see if anything is pushing out on one side more than the other, or if there's any kind of restricted motion in those joints. So Brooke has a little bit out here on the left. So the way an adjustment would work is if that vertebra is out of alignment, I'm going to use my hands to try to push that vertebra back into alignment, and also to get things moving a little bit better to give the nerves room to breathe. And when the pressure is taken off of the nerves, that's what allows the headaches to be relieved. Because the only reason why you're having the headaches, if it is coming from your neck, is because there's irritation on that nerve. Once that irritation is relieved, then the headaches take care of themselves. Here. So nice and easy, got good movement there, and so that should relieve, now that she's having a migraine headache right now, but that should help free up some of that restriction of motion that we found in there. So what we would want you to do is, that, like I said, get checked out by a chiropractor and make sure that those top 2 bones are in alignment and moving the way that they're supposed to. So that was a manual adjustment. There are times where we would prefer to use an instrument instead of our hands to adjust the spine. Either a patient who's uncomfortable with a cervical manual adjustment, or someone who has some reason, if they've had surgery, if they've had a fusion at some level in their spine, we wouldn't be able to adjust their spine normally. So when we have that situation, we have an instrument called the activator, which is a more gentle way of adjusting the cervical spine. And so there's no rotation, and it basically is an instrument that's very gentle on the spine. You can see that it's not really jolting my hand at all, but it's pretty comfortable for people to be able to do that. So what we would do is we'd palpate the same way we did with Brooke before. Since I just adjusted her, I'm not going to do that again. But I would find the area that's out of alignment, put the instrument up to her neck, and then pull the trigger, I guess we could say. So like I said, that is a lower force, non-rotational way to adjust the cervical spine if you are dealing with migraines. So hopefully you found this video interesting. If you're suffering from migraines or someone you know is, Getting checked out is going to be the number one thing that you can do to at least find out if it's something that chiropractic can help. If this video has helped you in any way, make sure you like it or share it with someone, or maybe even tag someone that you know might be suffering from migraines. We help hundreds of people in the office with headaches and with migraines. We've seen amazing results, and we'd love to be able to help you out.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.